Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. Today I'm here with Rory Stanton, the founder and CEO at Aila Health. How are you today?
Good, good. Thanks so much for having me. Great to chat with you again.
Yeah, I'm excited. I like to say it really slow at the end to create suspense for everyone that's listening.
Awesome.
So I'm really excited for us to talk. You and I chatted a couple weeks back, and we were able to get something on the books to record today. So I'm excited to dive into things. I love if you could kick things off by telling the audience a little bit about your background, and then we'll talk more about Isla Health.
Yeah, so I hail from Northern California. I'm in the Bay Area, and I've spent a number of years in digital health. I was kind of in the early days of digital health doing surveys on how consumers were utilizing the internet to research their symptoms and medications way back when, probably close to almost 10 years ago now. And over the course of kind of covering the industry, just became really fascinated and passionate with kind of this transition and consumerization of healthcare. And of course, digitization, which we've really seen a rapid ramp up of. So that's kind of what's led me into digital health. I spent a number of years on the East Coast doing consulting at a company called Decision Resources Group, working with a number of pharmaceutical, life sciences, health plans, companies, really kind of helping them build out their digital patient engagement strategies. And then came back to the West Coast, got my MBA, and decided to launch Aila Health, where we are building a platform for patients living with complex autoimmune conditions to better manage their care remotely.
And that was going to be my next question, and you kind of led into it perfectly. I always ask every guest on here, give me the why, how, what of the organization. And that is not my thing, by the way. I took that from Simon, was it Sinek, where he talks about, why great organizations really focus on that order: why, how, what, in order to sell, in order to get buy-in. So I've always loved learning that about a company, because that's the most important thing for me. Is there needs to be a strong why. I need to understand how the platform or how the team works, and then what exactly do you do, because it's not always clear for organizations in their descriptions what that is. So you already gave us kind of the what and a little bit of the why. I'd like to know why you decided to focus in on the I guess the chronic care space, as well as some other areas.
Yeah, so kind of in my background, actually, I ended up doing a lot of work for autoimmune brands. And in that process, I did a ton of patient research, kind of delving into the communities, understanding the elongated patient journeys of patients living with these complex chronic conditions, and just saw that that was really messed up. Like, it shouldn't take over 5, sometimes 10 years to get a diagnosis for an autoimmune disease, and then ultimately not even really have a great plan to manage that disease over time. And so kind of some of that research was foundational. And then I coupled that with actually a lot of my friends and family members went through their own diagnostic journeys with autoimmune and have, lived with kind of complications and poor health outcomes as a result of not getting access to great care. And so those two kinds of factors really drove me to figure out, why is this such an under studied area? And, why aren't there great resources out there for it? And that's what, why I decided to launch Aila Health. Quite frankly, it just kind of, frustrates me a bit, because it's a huge disease area. And I think most people don't even really know that. When you combine the 100+ autoimmune diseases, there's about 50 million Americans living with some sort of autoimmune condition today. Only half of them are diagnosed, and 75% of them are female. So you're looking at a population that, again, skews heavily female, super underserved. And I think we need to bring about resources that can actually serve those needs. And that's why I decided to get to work and really start building this out for people like my friends and family that were experiencing these kinds of chronic symptoms. And then in terms of, the what, why, what, how, in terms of the what, we've really kind of banded together this team of very passionate engineers, obviously people in digital health, clinicians that are really focused on, okay, how can we take technology and scale the expertise of some of these specialists in a way that can provide kind of expanded access to these people that are generally left behind, right? If you have this many patients within the population that aren't necessarily getting access to great care or getting delayed diagnosis, and therefore their disease is progressing more rapidly than it would otherwise if there was earlier interventions or better information or more proactive care management, you know, that's kind of why we came into play, right? Is to build a platform that could support that. And certainly, you know, to support that happening anywhere. Oftentimes specialist care is concentrated in academic urban medical centers, and patients living in rural areas 3-4 hours away from hospitals don't necessarily get a check-in with their rheumatologist or their gastroenterologist, you know, every day. And so we wanted to create a more scalable mechanism for patients to get access to answers, better content, and an ability to kind of track their conditions in tandem with their providers.
Well, it's also a really good time to be kind of pushing through in this space, right? COVID brought a lot of bad, but in terms of the good that it brought was really maybe pushing forward the digital transformation of healthcare a couple years into the future, right? And some say between 3 to 5 years, we've kind of jumped ahead in that digital health journey. So I definitely think it's the right time to continue pushing forward in the space that you're in. And I track a lot of these companies that are in the digital health space. You're going after, like you said, an underserved area, but one that affects so many people. I did not know the stat about women too. That's like, that's crazy that out of that amount of people, I think you said 75% women, which that's concerning. That's concerning. It's never good when that much of a certain population type is a part of something as massive as what you're going after. I'd like to focus in on, because I know you referenced this on your social pages and things like that, in case anyone's not aware of it, and you've kind of talked a little bit about it, but you refer to precision health management. Can you talk about what that's all about in a little more detail?
Yeah, so I think, you know, precision health is kind of like the next generation of healthcare, right? Is taking a personalized approach to medicine. We've seen a lot of kind of precision medicine and finding the right therapeutic for the right patient. That's obviously really taking off in oncology, because these diseases, specifically in autoimmune, have such variable phenotypes or variable expression of symptoms. So, you know, two patients with the same disease might have a completely different presentation. And therefore, it requires a very specialized, very personalized care plan for each individual patient. And I think, you know, autoimmune is just really ripe for that kind of leveraging of data and technology in new ways to be able to give that highly personalized, precise level of care to each and every individual. And that's really what we're trying to do, is really create a mechanism to capture data about each individual, understand how, you know, all of their unique attributes are interplaying with one another, and then leverage that to derive more personalized care plans for each person.
Thank you for that. I really appreciate it. It's I like you said, it's kind of that next way of delivering care, which is really cool. As we begin to wrap up a little bit here, Rory, I'm curious. So you started the company not too long ago. When was the official kind of launch?
Yeah, we started the company last year, just about end of last spring. Right, okay. Right as everything was closing down, we were actually just getting going.
Well, that being said, I'd love to hear, like, do you have plans on raising in the near future?
Yeah, so we've built a pretty compelling technology product. We're working on getting it out into the market. We're looking to bring on, you know, investors and partners and clients that are really interested in basically revolutionizing this space and tackling a really difficult space, but that really understand the need and find it just as important as we do. So yeah, we will be pursuing that later this fall.
Well, that's super exciting, and we wish you the best of luck on the raise.
Awesome.
Well, Rory, I want to thank you again so much for coming on the podcast. Hopefully we can have you on again real soon. I'd love to have you on as you begin to, as the raise closes up, the platform is out there, and we can kind of talk through some the other topics that are relevant at that time.
Great. Thanks so much, Jared.
Thank you.
Take care. Bye.